This is Janet, and with me on the line will be Chris Albrecht, the Executive Director of NSNU, and Paul Curry, who is our Occupational Health and Safety Consultant. That's where we have him here today to answer any complicated health and safety issues. I want to say a few things before I get to your questions, and then feel free to send questions to me, and I'll do my very best to answer. If I'm not able to answer because I don't know the answer, and neither Chris or Paul do, we will be sure to get back to you with the appropriate answer if we can seek it out somewhere. This has been a very, very unusual time in our healthcare system. As many of you know, you're working on the front lines. And before I start, I just want to send to you our heartfelt thank you. Nova Scotians are so very lucky that we have such a dedicated workforce in healthcare. Our nurses and other healthcare workers are going into work every single day, night, weekend, knowing that they could come in contact with this disease, and more importantly, they could bring it home to their family. So I really want to thank you for your dedication to this profession. I know that it's not what we signed up for necessarily, but here we are anyway, and you're continuing to go to work and giving your best to the patients and to Nova Scotians. And again, I thank you for that, and so do, quite frankly, most of all Nova Scotians and Canadians. So we've been really busy as well here at the union. Well, not here, I'm home. Our staff are working from home, but let me assure you they are working. The daily running of the union is still going on. We're still getting disciplines. We're still getting issues around grievances, and our labor relations staff are working full-time, doing what they do well, but just doing it from home. Still having meetings with the employers via the phone, still doing Zoom meetings and Skype meetings, and however mode they're doing it. Obviously, Paul and Justin are really, really busy answering questions, answering emails. Colleen and the communication staff are working extremely hard, updating our COVID webpage, answering questions, sending out material, working with other unions, both nationally and provincially, getting as much material into your hands as we can. We also, every day, we speak with various representatives of the Health Authority. We speak every day, pretty much, to the Department of Health and Wellness. We speak every day, several times a day, with the other healthcare unions in Nova Scotia and across the country. And we are also speaking a lot with our stakeholders around this COVID-19 related issues. The NSNU, in conjunction with the other healthcare unions, both nationally and provincially, have sent joint letters to our elected officials on those matters, whether it is a PPE concern, child care concern, transparency, accessibility to information. The unions we have been very, very busy and very involved. Many unions in this province, including the 4 major healthcare unions, as well as the paramedic union, are signatories to the Good Neighbor Protocol. I won't get into the nuts and bolts of that, but you can see it on our website at www.nsnu.ca/Good Neighbor Protocol. So take a look. If you have any questions, concerns, or issues arising from that, you can send me an email, and we'll provide you with the information. This protocol facilitates the sharing of human resources between jurisdictions and employers. So I may work for the Health Authority, but this protocol allows the Health Authority potentially to loan nurses, from our perspective, to maybe a long-term care facility, maybe to VON. This is a volunteer basis. I want you to know that they can't force you, if you're a VON nurse, to go work in long-term care. But the employer has agreed to continue your salary and your benefits, your workers' compensation. It would be as if you're still working. Well, you are still working for VON. Your paycheck, everything is the same, but you may be asked to work in a long-term care facility. I want to thank personally the several VON nurses who volunteered to work in a long-term care facility at the RK McDonald, Magnolia, and there's a third one, that the VON reached, the health authority reached out to the VON, or the Department of Health and Wellness, I'm sorry, reached out to the VON and said, can you help us out? Do you have any nurses? And do you have some CCAs that can go help these long-term care facilities, because those facilities had to take some staff out of their facility, for example, at the RK, and put those staff on 14-day quarantine. We know that long-term care has limited staff on a good day, but if you were to remove 5 or 6 staff out of the current mix, they wouldn't be able to keep their residents in the home. So thank you to the VON and to the VON nurses who volunteered to go work in those homes in this extraordinary time. Grievances and arbitrations that will require meetings, they will still go ahead. If you have a concern, if you believe that the collective agreement is not being followed by your employer, you can get in touch with your labor relations person, but you need to understand that we are getting literally hundreds of emails a day with concerns from our nurses. And so if it takes them a bit to get back to you, you need to understand and be patient. But trust me, somebody will get back to you. So I'm going to talk a little bit about PPEs now. So we know that suspected COVID patients, government and employers in Nova Scotia are recommending contact and droplet precautions, meaning gloves, gowns, eye protection, whether it's face shield or goggles, and a surgical mask. This is based on the recommendations from the Public Health Agency of Canada and the World Health Organization. If a nurse is involved in an aerosol-generating medical procedure with a confirmed or suspected COVID patient, they will observe airborne precautions. And for those of you who may not know what that is, the difference with an airborne precaution is you will be provided an N95 respirator or equivalent. AGMPs included but are not limited to, if you're involved in the room where an intubation is being done, manual ventilation is being done, open endotracheal suctioning is being done, CPR is being done, bronchoscopy, sputum induction, nebulizing therapy, non-invasive ventilation, open respiratory airway suctioning, high-frequency oscillatory ventilation, tracheostomy care, nebulized therapy, and that would be the aerosolization medication, high-flow heated oxygen therapy devices. If you are in doubt about whether or not you are involved in this procedure, just talk to your manager, the physician. Most of these procedures, respiratory therapy will be in the room. So if in doubt, and you're not sure what they're about to do, you ask the clinician that's with you to make sure that if that is the procedure, that everyone in the room dons an N95. And the employer, governments, there is no argument about N95s are required for this procedure. There's no argument, there's no debate. The debate and the argument when it comes to N95s is that is the only time PHAC, our provincial government, our employer, that is the only time they believe an N95 is required. And I'll talk to that a bit more in a second. Employers in all our sectors have taken measures to ensure these procedures occur as little as possible. For example, anyone that was getting a Ventolin aerosol, if at all possible, and for the most part, they've been moved to a Ventolin puffer so that they would not risk, they won't risk the transmission of COVID-19. We also know that these procedures should be done in an isolation or negative pressure rooms. Nurse unions across the country, though, are advocating that employers also recognize the nurse's point of care assessment. This means that if in the nurse's professional judgment, dealing with an individual case, they can deem a high level of PPE is required, this should not be unreasonably denied. For example, if you're caring for a COVID-19 patient and you believe that they could require ventilation fairly soon, if you believe that they're coughing and there's a lot of sputum, you should not be denied an N95. If you believe that there's a risk to you, you should be asking for an N95 and you should be getting it. My understanding from the last time I talked with the health authority, they tell me that they have not denied an N95 if the nurse or whomever is able to explain why they feel it's important to have an N95. So if you're looking after a COVID-19 patient and you are concerned, then you should discuss this with your manager or the clinician or the infection control folks in your facility to discuss what is the appropriate PPE for me to look after this patient safely for me, the nurse. Agreements recognize, there are agreements in BC, Alberta, Ontario, and now New Brunswick in which those governments have adopted that a nurse or a clinician can access an N95 if, in the clinician or nurse's opinion, it is required, and it will not be unreasonably denied. We have asked the same request of Nova Scotia, but we have not gotten agreement on that to this point. But those of you that know me, we haven't stopped. We're continuing to ask for it, but the practicality of that is, from my understanding, is if the nurse is able to say, I'm caring for this COVID-19 patient and I believe they're very, very ill and there's perspiring and they're coughing and I want an N95, my understanding is that it's not being unreasonably denied. And I'll stand corrected if I hear from you that that's not the case. That is what I've been told by the health authority, that they're having conversations with our staff about that. That now, one of the things that I've heard the most about, I would say, since the beginning of all this, is the new mask policy for acute care. The health authority just recently, yesterday, announced that employees working in clinical areas not treating COVID patients will be expected to wear one surgical mask for the duration of their shift. It is similar to wearing the same uniform all day, except you have to be particularly careful taking the mask on and off. The NSHA has produced a video to help with this, and if you're unsure how to do it properly, speak to your manager. So the mask will do no good if you take it off improperly or you put it on improperly. So if you're not sure, either watch the video or talk to your manager who gives you the mask. Now, a lot of people are concerned about one mask all day. It's not ideal, and we understand that, and we have expressed that concern to the employer that it's not ideal. However, at this point in time, there is a shortage of PPEs in general, so as much as possible, they want to conserve PPE equipment. That doesn't mean, though, that you have to have that same mask on all day if your mask is soiled, if it comes in direct contact with the patient, if it becomes moist or humid, and the integrity is affected. Some moisture in a mask is not unusual, but you need to understand that it's not the same mask all day if any of those conditions. So luckily, we are all nurses, and we know that we have good assessment skills. We know that we make clinical decisions every single day that affects our practice. My advice to you is, if in your clinical opinion you need to change your surgical mask because of any of the things I just listed, or if you're concerned that you may have touched the mask with a dirty glove, then our position to the employer is that that request for a new mask will not be denied. Now, I also want to be clear that this only affects healthcare workers, nurses, and others that don't normally wear a mask. So if you work on a maternal child ward, there's no COVID-19 patients on the ward, you don't normally wear a mask, you will be that person wearing the mask. If you're on a COVID-19 ward or caring for a patient that could be COVID-19 positive, you wear the proper PPE, which is what, as I said before, a mask, goggles or shield, gloves, and gown. So if you enter a droplet precaution room, you may keep your surgical mask if you have a face shield over, but you take the face shield off when you come out. The same if you only have goggles, then you must replace that surgical mask. Now, NSNU, we are not infection control specialists. We have infection control specialists in most of our facilities, and we are going to have an increased presence of infection control. There's lots and lots of information on the NSHA webpage, the IWKs, the VON is communicating with their members. Long-term care are starting to do their plans. So if you have concerns about the infection control practices in your facility, in your hospital, or in the home, you need to have those conversations with your manager. The mask policy in the VON and long-term care is just starting to roll out. The VON has instituted a new mask policy as well for low-risk clients. They will be provided with eye protection and surgical masks. The surgical masks and goggles should be maintained and used for several clients. If the eye protection presents a vision impairment for driving, they are to be removed and disinfected and use your disinfection procedures. If the mask is removed, it is to be discarded. For moderate risk clients, the mask is only maintained while in the same building. So if there are 2 or more clients in the building, it can be kept on. After this visit, it is to be discarded. For clients with confirmed COVID-19, the same protections as in acute care are used: mask, goggles, face shields, gowns, and gloves. Respirators or the N95 would be used for aerosol generating procedures. So they have the same policy as the acute care folks do now. In long-term care, there are unfortunately many different practices around mask use and PPEs. We have reached out, we've sent an email to each of the facilities where we represent the nurses and asked them to provide us with their plan. And we've gotten some. For example, Shanix intends to have 3 COVID-19 units. Let's pray to God they never, ever, ever see a resident. But if and when it happens, they are getting very well prepared to treat the COVID-19 long-term care resident in the home. They will have 3 sort of centers of excellence with the same staff working in those homes. Again, they ask for volunteers. They will be providing them with uniforms. They will be providing them with all the PPE they need. They're going to restrict access completely to those units. So everyone is working hard out there to make sure that they get as prepared as they can to fight this virus. It's really difficult because every day we turn on the news, there's something new. Like this week, the mask came out. Every day there's new information. And we're trying really hard as an organization to keep up with the changes and to make sure that those changes keep our nurses safe. So the acute care scrub policy, again, we just found this out this week. The health authority, they are going to start providing hospital scrubs to certain patient care areas in order to reduce the spread of the infection. These areas will be in our emerge departments, in our ICUs, in our COVID inpatient areas, in our ancillary service dedicated to COVID, and in X-ray. So the health authority is working hard now to get scrubs for all of those places. They're rolling this out this week. So if you haven't got it, if you're working in an ICU in Yarmouth and you haven't got that yet, I'm being told they're working as quickly as they can to make that happen. So we get a lot of conversation and a lot of questions over the last, it seems like forever, that we've been doing this, about what about if I don't feel safe. I'm not comfortable. I don't want to work with a COVID-19 patient. First of all, if you have anxiety around that, you should again have a conversation with your manager about it. It doesn't mean that you won't work. It could mean, though, depending on your level of anxiety and your reasoning, that you could be moved to another unit for the time being or not assigned a COVID-19 patient. Our preference, and we've expressed that to the health authority, is that you should be asking nurses if they agree to work in the COVID-19. I know some are being voluntold. I know some are not volunteering, but I do know some nurses have volunteered and are willing to go work in the COVID-19. Our recommendation around pregnant nurses and immunosuppressed nurses and maybe nurses that live with their, I'm going to say, 85-year-old mom, and it's just the nurse and their mother or father. Again, the health authority and the IWK and Shanix and I'm not sure about VON, but I'll check. They've agreed that wherever possible, they won't expect those individuals to care for COVID-19 patients. I want to be really clear, though. Doesn't mean that you're not going to work. It means that you're going to be working on another unit or in another capacity for the health authority or for whatever employer you work for. Now, all that to say, I still want to refuse. I'm not immunosuppressed. I'm not pregnant. I just don't want to. I just don't feel comfortable. There is a very detailed process on how and when you get to refuse work. So the Nova Scotia Occupational Health and Safety Act does protect workers from unsafe work. What you must do, you just can't say, I don't feel safe, I'm not doing it. The first thing you have to do is go talk to your supervisor, like I explained earlier. Talk to your supervisor, talk to your manager, explain why you feel what you're being asked to do is unsafe. If she or he says, you know what, I don't agree with you, I believe that this is a reasonable ask, I believe that you are safe to care for this patient, we're giving you the PPE, and we believe that we're good. You then, their next step is every one of your facilities should have a health and safety committee or a JOSH committee. On those committees, there are members. And if you don't know who that is something that you need to find out about, is who is my JOSH committee member at the Aberdeen Hospital. Then you take your concern to the JOSH committee. If the JOSH committee says, no, I think we're good, we agree with the employer, you can bring it to the Department of Labor. Until the matter is resolved, though, no other employee shall be assigned the work unless they agree to after they are first informed. So taking COVID out of this, for example, if a patient was extremely violent and I as a nurse said, I don't want to care for this individual because every time I do, I get hit, slapped, punched, kicked. And I take it to my manager who says, oh, there's not much I can do about that. Take it to the JOSH committee. And they in turn say, well, there's not much we can do. The Department of Labor could write orders to the employer to say, you need to provide protection for the staff that interact with this patient, and these are some of the steps you might consider taking to make sure that the staff isn't put at risk. And then while that process is going underway, the next nurse that comes on shift somebody should be informing them, oh, by the way, we had a work refusal with that patient because of the risk assessment showed that he or she had violent tendencies. So we will help you as an organization to complete the work refusal stuff. So I would like you to take a look at www.nsnu.ca/RI, right to refuse. So we will help you with the process. And Paul Curry, who's on the call, and his email is Paul, P-A-U-L, .Curry, C-U-R-R-Y, @nsnu.ca. So you can send Paul an email and explain to him, this is what I've been asked to do. I do not feel safe, and he will have a conversation with you about the reasonableness of what the employer is asking you to do. And if you feel strongly, then he will help you go through the work refusal process. What's all the concern about rationing our gloves and our masks and our gowns and our my understanding, and I haven't heard it officially, I heard the Premier say it on one of his press releases, is that we have enough PPEs to last another month, and there is more coming. There is, however, as most of you can see and see on TV, there is a global supply issues for all aspects of PPE. This is one of the reasons why the employer is saying in their documentation, this is one of the reasons why they want to restrict surgical masks to 1 to 2 a shift. We've had discussions with the employer around this conservation, as well as the appropriateness of sterilization and reusing the respirators. Unfortunately, these sort of conservations, we're forced to. This is the time. So we have to weigh out and do our risk assessment, as I indicated earlier, because quite frankly, folks, the fact that we don't have enough N95s, I understand, and I've heard a lot of nurses say that's not my problem. However, it kind of is our problem, because here we are, we're in it now. We have to think a little bit longer term. At some point, it's not just ventilating or putting a COVID-19 patient on a ventilator. We are going to, at some point, get a pregnant lady positive for COVID-19 that's going to require a C-section. That individual is going to have to be tubed. They will have to have N95s. There is no question about that. We are going to have a patient requiring an appendectomy. It's coming. And that person might be COVID-19 positive. The staff in the OR and the anesthetist will need N95s. Again, no question about that. So we really are at a place now where we have to use discretion when and if we need an N95. We're saying, and we continue to say, that our nurses, they are not going to steal from themselves. So they are not going to be asking for N95s knowing that 2 weeks from now we could have none left. Our nurses are able to make their own clinical assessments when dealing with COVID-19 about the use or not of N95. However, we still say that we need to talk to our managers about, this is my rationale for wanting an N95. And my rationale is because, and we're able to have those kinds of conversations with our nurse manager, and our view is you should not be denied. And if you are, I would give a shout out to one of either myself or Paul, and we'll try and talk to the manager and try and understand why it is the manager disagrees with your clinical nursing assessment. Every long-term care provider in the province is developing a COVID-19 plan. The hope is that we will be able to keep our residents in the home and not in our facilities. There will be conversations, very unfortunate conversations, with many of the residents' families to talk about if your loved one were to get COVID-19, what is your plan? And if the plan is that they are to be actively treated, including and up to intubation, obviously they will be transferred to one of our facilities in acute care to be cared for on a COVID-19 unit. As you know, for some time now, families and visitors have not been permitted in our long-term care facilities, and we've really restricted the visitors within our healthcare facilities as well. I know you know this, and I get it, but it's a real struggle for some of our family members who were very devoted to their mom or dad or aunt or uncle, and now it's been weeks since they've been able to see them, and it's very stressful. I think it's unfortunate that some of these families are taking their stress out on our staff, and obviously it's not acceptable, but it's very, very difficult for people to be going in, having operations with nobody with them, waking up, nobody there, very limited contact with the nursing staff, because at all possible we need to remain our social distancing, staying 6 feet out. So the touching and the comforting that we as nurses have done for our whole careers is really limited, and it's hard for us as nurses to be in this space where we're not able to provide some comforts to our patients. But we have to think about ourselves, we have to think about our families, and we have to think about what's best for the facility. And oops, something just binged. So I understand how tough this is. We all do, but safety is the number one thing that we have to deal with right now. And you know that some of the nurses that I'm concerned about the most are those that are still doing the home visits. Home visits, they are screening before they go into the home, but we are finding out that some members in the home can be less than honest because they don't want to lose their home care, so they don't tell our nurses that Johnny was here yesterday and we think he had COVID-19 or he tested positive for COVID-19. We are trying to send the message very, very clearly through our home care employer that is not acceptable. When VON finds out that there is a breach, a patient is positive, or there was any kind of a breach in confidence in the information the client has given to the nurse before she enters, they will discontinue care, and they have discontinued care for that client for 14 days. Those kinds of behaviors and actions from patients are unacceptable. It's not fair for those to put that VON nurse at risk, and secondly, to put all of the subsequent clients that VON nurse will see at risk as well. So nurses are asking, and we are publicly pleading with people to be honest, to be truthful, and tell us if you've been in contact with anyone outside of your own home. The other thing, if nurses, a lot of questions around if I'm sent home for 2 weeks, what happens to my pay? Your pay, if you are sent home, so your employer comes to you and says, you're to go home because you came in contact with a COVID-19 patient and you weren't properly PPE'd, then you are to go home, you'll get swabbed, and for now, you'll be quarantined for 14 days. You will go on admin leave. That means leave with pay. It doesn't come out of your sick bank. It doesn't come out of your vacation time. It doesn't come out of any bank at all. You're off with leave, paid leave from the employer. However, you need to understand, you go home and you stay home. You're on quarantine. You don't go out. You don't go to Sobeys. You don't go anywhere. A lot of people are very concerned, obviously, about having nurses and healthcare workers in their neighborhood. But we're assuring people that if a nurse is quarantined, they will be getting paid, and they will not be leaving their home. I will caution you, though, that if you get COVID-19, you should start the process, talk to your employer, and start the process for workers' compensation. Because this disease, unlike many other diseases or injuries at work, I shouldn't say necessarily diseases, there's a pretty strong linkage if I get COVID-19 and I'm a nurse that I got it at work. And that's what workers' compensation is for. Workers' compensation is an injury or an illness that I acquired through my workplace. I don't think there's a whole lot of arguments about I'm a nurse, I work on a unit, there's a COVID-19 patient on the unit, and I have COVID-19 a week later. You should apply for workers' comp and get the paperwork rolling. The thing about workers' comp is any treatment requirements will be paid for by workers' comp, and depending on how long you're off, you may not have sick time to supply you with an income. So I encourage you to start the paperwork for workers' comp. Currently, there's really no evidence that pregnant women are more susceptible to contracting COVID and do not have worse outcomes. Nevertheless, like I said earlier, if you're pregnant and uncomfortable working on a COVID unit, you may ask to be reassigned. Given that we lack sufficient evidence, the union will be encouraging employers. The IWK and the Nova Scotia Health Authority, and I believe Shanix as well, have agreed that they will not require a pregnant nurse to work in with a COVID-19 patient, resident, or in a unit that has COVID-19. They'll be reassigned. If you have immunosuppressed, you have any kind of an illness, like if you're a bad asthmatic, you have a heart condition, or just have a conversation with your primary care, either nurse practitioner or family doc, and have a conversation with them about, based on my medical needs, do you think it's safe for me to work in and around and with COVID-19 patients? And I'm sure that there will be respect from your employer if your physician says that you shouldn't be working with COVID-19 patients. If you have any issues around any of this, obviously you can call either your local president or you can call our union office, and somebody will help you. So workers, including nurses, may be allowed to work even if they've traveled, provided they do not have symptoms. So who runs and who decides who works and who doesn't, and how long and how far and who gets, it's all under the auspices of the public health, and it's all done on an individual basis. So if you were in contact with a COVID-19 patient, the public health, not your employer, decides, Janet Hazelton's going to be off on isolation for 14 days. Public health gives that direction to your employer, and your employer doesn't get to say, oh, well, ignore that. I want you to come and we'll put you on, we'll put a PPE on you and you'll be fine. Because you don't, that's not how it goes. Public health are the ones that make those kinds of decisions, and they inform your employer. If they put you off, once again, you're on admin leave with pay. I know some of our long-term care facilities are saying, no, it's sick time. We will sort that out on an individual basis. So please call us, and someone will call your employer and have a conversation with them. Nurses who have symptoms should report this to their manager. Healthcare workers have a dedicated COVID line, so nurses and healthcare workers do not have to go through 811. There is a number. I'll read it slowly. 1-833-750-0632. That's for healthcare workers. So if you believe you have symptoms, the general public are going through the 811, filling out a questionnaire and getting directions from the staff at 811 whether you should be tested or not. The health authority and the government has a special line for healthcare workers and that includes all healthcare workers, except for the ones that work at the IWK, and the IWK has their own numbers, and they have, I think, 3 occupational health lines. So you can access information if you work at the IWK differently than if you're a healthcare worker. And the healthcare workers, all healthcare workers, can use that number. So you don't have to access 811. Most of our clinics are assessment clinics. My understanding, and I would stand to be corrected, so if you're working in an assessment clinic, and this is not the case, we want to hear from you. My understanding is when the patient comes in, that has been directed there by 811. So no one's going to our assessment. No, there's no walk-ins or drop-ins. You get an appointment via 811 to go to our assessment clinics. And when you go to our assessment clinic, you'll be met and screened at the door. You'll be given gloves and a mask, the patient. And the paperwork, my understanding is the admin now is behind plexiglass, or if they're not, they're going to be, because they're urgently putting up plexiglass everywhere. And then the nurse that swabs the patient is gowned with a face shield, surgical mask, gloves, and gown. And they take the swab. The patient doesn't take their mask off only when they're getting swabbed. So if that's not the case, we want to hear from you. We want to hear from you if you're being denied PPE and you're treating a COVID-19 patient. If your manager or somebody is telling you that you can't have whatever, then we want to hear from you. Okay, what time is it? 11:45. So Chris is on the line, and she's got some questions. Chris?
I am. Yep, here I am. So what we've tried to do is, because we don't have a lot of time, I've tried to sort of lump together some of the questions so that there'll be themes. And so hopefully, even though your actual question might not be read, the answer to your question will be provided on the call. If not, some of the questions are very specific, so they'll be forwarded to the labor reps for follow-up after the call. So just bear with us for a bit, and we will get your answers to you. So the first question, Janet, is around what about folks who are concerned with drinking fluids, staying hydrated, and being well-nourished during, since this new directive has come out related to the 2 masks per day?
So again, before I start that, I just want to tell folks there's lots of questions. So if you want, I'm prepared to stay as long as you need me to stay. So we'll get to the question. So if we're after 12, we're after 12. No big deal. So about hydration, I think it's very clear in everything that I read from the NSHA and the IWK is you have your mask on in patient care areas and you take it off to provide yourself with your breaks and your meals. So as long as you take your mask off carefully and put it back on carefully, then you should be fine. There's no reason why, but they don't want you sitting, drinking a cup of coffee at the nurse's station. So these are different times for sure, but what they're trying to do is decrease the spread of this virus throughout the facility. Or if I'm a nurse working with you and I may have it, but I'm not symptomatic, so if I have my mask on, it gives you better protection so that you don't get it from me. Now, I want to remind people, and I don't need to remind you because you know this, nothing. We've got to go back to our universal precautions. If you're washing your hands before you go in a room, after you come out of a room, keep your hands away from your face, keep your hands off your mask, you should be fine. If you touch your mask, and you know that you hadn't washed your hands, then get a new mask. Nobody out there wants to see any healthcare worker get sick. They don't want that to happen, and they're trying their best to protect the staff in the facilities with whatever the latest information that they get. Next one.
Okay, I work in a small emergency room, and so far my colleagues and I have not been practicing social distancing at work. We haven't been 6 feet apart. We are now allowed to start wearing masks. That's a practice I've been doing all along. Have other emerges been 6 feet away from their coworkers? I believe we should always be 6 feet away except when giving direct care.
I agree with you. Wherever possible, we should be distancing ourselves from our coworkers. And I don't just mean the other nurses that I'm working with, the kitchen staff. This is extraordinary times. If you can manage your patient care and maintain social distancing, then that is what's preferable. So go into the room. Normally we would walk right into the room, right up to the patient's bed to make sure that they were okay. Now you can go into the room, maintain the 6 feet, you can see your patient, you can say hi, you can talk to your patient. Unless you're given direct care, try very hard to maintain 6 feet. And it's difficult, I understand that, but we need to get rid of this virus before it takes any more lives in this province.
Okay. Where does the union stand on trained nurses working in the COVID environments getting the same pay as those nurses who are working from home or in a low-risk area?
So again, that's a question that's being asked, danger pay. Some nurses are referring to it as. So right now, the focus of the nurses union and the other healthcare unions in this province is getting proper PPEs, getting information out to our members on proper PPEs, making sure that long-term care have a plan, like facilities have a plan, making sure that we can keep our staff healthy, making sure that we have the staff when some are going to be isolated, how the backfilling is going to happen, whether or not there's proper orientation when you go to a new unit. All of those things, we're flat out doing that. As you know, your employer is pretty flat out. We have conversations a couple times a day, 7 days a week since this started. So right now, we believe that for now, we will have those conversations at a later date.
Hey, I'm a registered nurse working in Cape Breton. I have 2 young children and my husband's a paramedic. Due to COVID-19 restrictions and my family's safety, I've been taking time off work when required. I have to use vacation or sick time, which is not fair as this is not what my allotted banks are for. I am very fortunate to be able to get paid for those days, of course, but the banks may get depleted and not be available when needed for their intended purposes. What are my options?
Quite frankly, you don't have options other than you can talk to your manager. So if your husband, who is a paramedic, works, I'm going to make this up, 7 to 3, you can ask to work an alternate shift to that. So you can work with your manager to say, you know, we have no daycare, we have no childcare. Can I work 3 to 11? Or, you know, I've been told by lots of people that the employers and all essential service employers, including EHS, are open to having conversations with their staff to make sure that we can maybe switch shifts. I can switch my shifts around. Maybe I can work the weekend. But if you're taking time off because you don't have childcare, for right now, that would be vacation time, not sick time, vacation time, or leave without pay.
Okay, can the employer change nurses' shift schedules, rotations, and shift length during this state of emergency? What rights in relation to our collective agreement do nurses have during this crisis, and is our contract null and void?
No, our contract is not null and void. The overtime provisions still apply. However, if your unit is being closed because you work in an ambulatory care unit, your employer does have the right to reassign you to another unit that may work different hours. So you may go from a Monday to Friday, 8 to 4 job to a job that will require you to work 12-hour shifts, days, nights. So they do have the ability. And they will take from the units that are closing first. So they're not going to be transferring a medical unit nurse when they have available nurses that aren't working because they work in a clinic that's now closed. But all other provisions of the collective agreement apply.
Sorry, just a sec. There was an incident that occurred in Cape Breton. Are you able to give us any indication about what happened there? My understanding is that we have about 40 nurses in isolation.
I don't think the number is quite 40. I'm not 100% sure about the number. However, my understanding is that many people came in contact with a patient that was positive for COVID-19, and they did not have the PPE on. So they had no mask, they had no shield, they had no gloves, they had no gown. So therefore, they are presumed that they could have COVID-19. Those nurses and other staff would be sent home for a 14-day quarantine, and they will be tested to make sure that they didn't get COVID-19.
Okay. I work with VON. We were told that if we feel we need to wear a mask, that's fine, but if we're wearing a mask, we must also wear goggles or a face shield. We cannot just wear a mask. Is goggles with a mask always necessary?
I will have to check on that for the directive from VON, because I just got the directives from VON like a half an hour before I did this call, so I'm not sure. Depending, I think there is levels of what VON are asking their nurses to do, depending on their risk assessment of the potential of COVID-19. I believe, and I read it quickly, was that if it's a low-risk client, again, the nurse makes a clinical judgment about what proper equipment they should be wearing.
Okay, this question is coming. Oh, my computer's frozen. Okay. Several of my colleagues are dealing with child care issues. Our employer is not allowing us to take time off without pay. We are using up our banks and vacation. Why can't we take time off without pay?
I think that's an individual. I understand your question. I would encourage people that are having child care issues and had a discussion with their manager, and there's no resolve. They're not willing to change your schedule. They're not willing to change your shifts around to accommodate your child care challenges. If you've made every reasonable effort to get child care and you just cannot get it, and your nurse manager won't allow you to take off time without pay, I think you should call one of our labor relations staff, and they will help you address this issue. It would be an individual issue. I think that the employer is telling me, certainly, that they won't be unreasonable. So if they can accommodate our nurses because of childcare, they have indicated to me that they will. So if I were you, I would call one of our labor relations staff, and together you might be able to find a resolution and have a conversation about whether your manager is being reasonable or not.
Okay, this is a question from the IWK. If we want to limit exposure and ensure safety of our nurses to our best ability, could we start to have nurses on call? This would mean there's a rotating list, and if nurses don't need to be floated to other care areas, could they be paid their normal hours but stay home safe and avoiding exposure to themselves to unnecessarily coming into the hospital? And then if they are needed, they'd be called for the shift and come in.
So we do have on-call language in our collective agreement. So that language on the on-call would apply. So again, it's another conversation that you should, and we could be having with your employer. But for right now, the current collective agreement has language around on-call, putting person on call, and what their compensation would be.
How will mandatory mask wearing be enforced for those who are refusing to wear one?
That is a good question, and I don't know the answer to it. I think, like the mask wearing, it's no different than, our all kinds of policies that we have. We have policies around what uniforms you can and can't wear. We have policies around where we can smoke and where you can't smoke. So it'll depend on how your employer wants to enforce this new policy. It is a policy. It is the direction of your employer, and quite frankly, you have to follow the policy unless and until you talk to your manager and you have a reason why you can't wear a mask and your manager agrees.
In regards to the surgical masks, if we can get masks that are deemed safe, for example, they've used an example there of a Norwex mask, can we use these masks?
To this point, everything I've read on the Health Authority and the IWK is no. They are saying that they want to supply the masks because they know the integrity, they know how suitable it is, they know how much protection it gives. So everything I've read, they've said no.
Okay. I'm an RN working in the Emerge department. I'm in complete agreement of wearing a mask during our shift, but I'm wondering if anyone knows what the risk is of doffing a used surgical mask to eat, putting that mask in a paper bag, and then reusing it when our break is over. What if the mask is contaminated on the outside? Even if you're carefully folding it, it seems risky. I understand the shortage of PPE, but I just want to know if there's anyone out there who has studied the risk in reusing a mask that may have been on for hours after already wearing it.
So I don't know if there's specific literature around it, but if in doubt, my advice is if you take off your mask to eat your lunch and you are concerned that it's not, that you've done something to make that mask not safe for you to put back on, then you don't put it back on. Err on the side of caution. Again, use your risk assessment, use your nursing assessment to say, I am not 100% sure that I didn't contaminate that mask. So, and go ask for a new one if you're not sure.
We at VON are now being issued 2 masks per shift. We have been told that low-risk clients still do not require the nurse to be masked at all and to use assessments and judgment. So also nurses are expected to do aerosols in the home of a suspected or COVID-19 client.
So VON just came out this morning with new guidelines around masks. So I'd encourage you to take a look at that. If you are asked to be doing an aerosolization process and it's with a COVID-19 patient, nurses in VON have full PPE that they can put on when they're asked to do that. If you're concerned at all, and just send us an email, and we'll walk you through the process and or speak to the VON employer on your behalf.
Can I refuse to be reassigned?
No. The short answer is no. However, there are certain responsibilities that the employer has when they reassign you. So if they are to reassign you to a floor, they have to provide adequate orientation to the floor. They have to ensure that you're able to do the skills that are required on that floor. And if you're not, they can't ask you to do something that you haven't been taught, you don't know how, or you don't have a comfort level with. So there are obligations that the employer has to follow when they transfer you, like orientation. But the short answer is, if I work in a clinic and my clinic is closed and they want to reassign me to the medicine unit, then I have to go to the medicine unit, I get orientated, and I do and care for the patients on that unit that I'm comfortable to care for.
Okay, the next one is, I understand the good neighbor policy. However, can I be forced to work in another facility like a long-term care facility? I understand this is happening in other provinces.
As the good neighbor policy is volunteer, it's very clear that the nurse has to volunteer. So when we had, and we've had VON nurses, again, I thank them, who there was a crisis in some of our long-term care facilities. VON, the employer, put out a call to say, would anybody be willing to go work some shifts in this facility? And that there were nurses that volunteered and work and are continuing to work in that long-term care facility. So the good neighbor policy is volunteer only. I know in other provinces, some other provinces, they are sort of, Ontario, I believe, sort of threw out the collective agreement and are going to or have or will reassign nurses, but we're not there yet, and hopefully, God willing, we never will get there.
I am a casual nurse that works in the emerge department and in the COVID emerge area. What, if any, compensation is available to me if I test positive or if I'm sent home because of a known exposure?
So I'm sorry, can you repeat that, Chris?
Sure. I'm a casual nurse that works in the emerge department and in the COVID emerge area. What, if any, compensation is available if I test positive or if I'm sent home because of a known exposure?
That is an excellent question, and one that I'll have to discuss with Chris and the other labor relations staff. Because you're casual, you don't have sick time. But if you're exposed, obviously you fill out your workers' comp, and I know that workers' comp might take some time to get through, but you should get compensated through workers' comp. But we will raise this concern with the employer about casuals that, I know workers' comp, that's a for sure, but we'll raise this with the Department of Health and Wellness. I'm not sure if we get a resolve to it or not, but we will raise that question.
I am a registered nurse from a mental health unit that is temporarily closed related to the pandemic. I've been awaiting reassignment by my manager and human resources. I understand that I should be paid administrative leave because my employer has told me not to report to work and to wait from home. Is this correct?
That is correct.
Okay. I am wondering why the expectation in a nursing home is that there are COVID patients that nurses are assigned to that unit and remain there. But in hospitals, we are sending them to specialized units.
So long-term care is just, some long-term care facilities are a bit more advanced than others on their COVID planning. My understanding, though, is that most, if not all, will have dedicated COVID resident beds, and those residents will be in isolation while they have symptoms and for the 14 days until they are negative and symptom-free. That is my understanding. They want as much as they can to keep the resident in the home, and they will transfer it out to hospital if and when the resident requires care and treatment that can't be provided in a long-term care facility. And we all know that there are certain treatments and care that long-term care nurses don't have the time to do, and they don't do. What I've been told is that will continue, and that they will move their COVID residents in a cohort so that they're in the same wing, or depending on the size of the facility, of course, and they're going to try and segregate them, and they will isolate them.
My husband works in another province, and he will be home soon. If he needs to isolate, does that mean I have to isolate as a nurse who works for VON?
No, I don't believe, Paul could probably, I don't believe that she would have to isolate. I'm just waiting for Paul to pick up.
Can you repeat that, Chris? I couldn't understand it fully.
So if my husband works in Alberta and he comes home, do I have to isolate with him?
I haven't read anything about that, but that probably goes back to public health, I would say, right, Chris?
Yeah, well, that's public health, but remember
But no, the answer is no.
Yeah, there was one case where we've already dealt with this once, but public health will give you, the VON nurse, very specific instructions on what they expect you and you to do.
Correct.
Okay.
I don't have any new questions that have come in the last couple of minutes, and I feel as though there's a few there, but we've covered them. Janet?
Yeah, okay. So
Yep.
I just want to thank everyone for your time. I know that this is unusual times. It's certainly created a lot of anxiety amongst Canadians the world over. But, you know, I look every day and I see pictures every day and I talk to nurses every day that their anxiety level is heightened for sure, but they're continuing to do their job. They're continuing to treat patients and look after residents and go into people's home when there's a whole bunch of uncertainty about all kinds of things. Every day we hear about a new COVID-19 numbers. I mean, we used to get up and look to see what the weather's like. Now we get up and see how many COVID-19 patients we have in Nova Scotia. It is really challenging times. This weekend is going to be extremely challenging because it's a 4-day weekend, and people, I don't know why, some people are not getting it. They're not social distancing. They're out and about. They're having visitors in their home. I think it's very, very unfortunate that people are not taking this seriously because they're not just risking their health, they're risking the healthcare workers' health, and we cannot afford to have healthcare workers get sick and be off for extended periods of time. I want to thank you so much for everything you do every single day. This is something that is unusual, but the professionalism, the way you're caring for individuals is unreal. Because now we don't have families in to help us care for our residents. We don't have family members in to look after someone post-op or to be in the room with them. And they are going to be relying on nurses more now than they ever did. And nurses are the heroes of healthcare. There's no question about that. Nova Scotians appreciate everything you do every day of the week, 7 days, night, day, like unbelievable how much support you and healthcare workers have with the public. We are so proud of you at the Nurses Union. We are so proud to be able to represent you every single day. We're so proud that we have such a dedicated workforce. I want to thank you from all of us for everything you do. I want to remind you that although our office is closed, we are all working virtually. We are all doing everything we can to keep you safe. Our job as a union is to protect you and to protect your rights and to make sure that you go home at the end of your shift during these challenging times safe. And you stay safe and you go back to work safe. We are out there 100%. I forgot to mention at the top of the call, Linda Silas, our national president, is listening in on this call. She is very, very concerned about the health and safety of healthcare workers and specifically nurses. She's working very hard federally to make sure that the governments and others get it, that they understand the risk that nurses are experiencing every day. Not just during COVID-19, we've gone through lots of risks. We've had violence, we've had SARS, we've had HIV. We've done a lot. Nothing like this has happened to us before, where our whole province is pretty much locked down. The only people that are out there working are people like you. And thank you so much. Call us anytime. Send us emails. My email address is on the website. You can send me emails anytime you want. The labor relations staff are there to help. Paul is there. If you need and want something communicated, we have our communication staff. So we're still all here working, and we have a board of directors. We meet once a week virtually now to discuss issues and concerns and get reports about what's happening out there. And anytime we see an issue that we think needs to be addressed, we're on it. We are on it. We're all over it. And everyone wants you to be safe. Everyone is doing their best. But you're the one taking the risk. We understand that, and we appreciate it. And if anything we can do to help, make sure you reach out to us, and we'll get back to you just as soon as we can. Thanks for tuning in. Next week, I'm hoping that maybe do a Facebook Live so that I can not see some of you, but you can see me at least. We're working on that, and just stay tuned. Our communication staff we have a dedicated COVID website page, and we're going to have one with the other healthcare unions soon. Anyway, so
Janet, can I just throw something in there for a second?
Yeah.
So it's Chris. There are a couple of questions that have trickled in after the fact. Any questions, like I said, that didn't get answered today, and there's been a lot of ground covered today by Janet, but we will absolutely respond individually to folks.
Yeah. So, and we've been answering questions full on every day, all day. You know, I'm getting, I get probably every time I go to do something and come back 15 minutes later, I have another 40 emails. And again, we're all trying to answer as best we can. But don't forget, you have infection control staff in your facilities. You have managers. You have people that you should be, accessing. If you have a question about your PPE or how to put on a mask, how to take on the mask, what makes this the best and the latest and greatest, talk to your infection control specialist. Those people are trained in infection control, and my understanding is there's a fair number of them. The other place is you have occupational health and safety staff within the health authority and within some of your facilities. Reach out to them. Have conversations with your JOSH committee. Utilize whatever it is you need to stay safe. And by all means, get in touch with the Nurses Union when and if you need us. Take care. Have an interesting Easter weekend. Hopefully everyone will stay safe, and hopefully this province won't have any healthcare workers that get ill with the COVID-19. Thank you very much, and talk to you next week likely.